Hello viewers, welcome to our channel 4M USA. This is Mahmuda. You are watching this channel. This is a North America based channel promoting on mental health. 4M stands for mental health, migration, multilanguage and culture, and also mindfulness. So we are practicing mindfulness beyond border. Today we are going to introduce our another new guest and also who is the experienced on physical activity and the relationship with mental health. We will learn more about him. So please welcome Simon and introduce yourself. Thank you very much.
Thanks, Mahmuda. Thanks so much for having me. I'm really excited to talk to you today. So my name's Simon. I'm an associate professor at the University of New South Wales in Sydney in Australia, and I study physical activity and the relationship with mental health and mental illness, and also for people that have been exposed to trauma. So we do a lot of work with veterans, emergency service workers, and refugees as well.
Okay, thank you very much. This episode, like Global Mental Health Journey, we are trying to connect physical activities and mental health. So, Simon, I know you have been working with refugee context, and also you have a research already. It's been published in Intervention Journal, so we know this very well. So today we are interested to know more about this, how you could relate these things, and especially people who are in confined, who had little opportunity to move out. How did you work on it? So you can explain the relationship with physical activity and mental health, and also about your research and publication, how you did it and how it actually worked, the possibility and difficulties and everything you can discuss with us. Thank you very much. Yeah.
Thanks, Mahmuda. So I guess the first thing that I would say, and it's really exciting for me to be able to share this work with this audience. We've known for a very long time that physical activity impacts our physical health. Everyone, we know that if we move our bodies more, it's good for our heart and lungs. It's good for our risk of things like diabetes and our physical health. But increasingly what we're seeing is the critical impact or the critical effect that physical activity has on our mental health as well. It's not just our physical health. So my career has focused on trying to understand the relationship, and particularly for those that are experiencing mental illness. So if we think about people that are living with, be it depression or schizophrenia or post-traumatic stress disorder, trying to understand what is the role of physical activity for those people. And I can, I guess give a quick summary of what we do know to date. And I think what is very easy to say is that we know that it can have a big impact on reducing symptoms. So helping people recover, people heal, and manage their condition day to day. What we do know, though, is that it's often the people that are most unwell are the least likely to have the support they need, or at least likely to have the infrastructure or the resources around them to actually participate in activity. So an example would be, if we think about a hospital or an inpatient facility, if someone is severely unwell, probably exercising is the last thing that they want to do at that time. And so what we've done here in Australia and in other places around the world is create programs where we actually provide one-on-one support to help people to engage in exercise. So just like, we have psychologists providing talking-based therapy, we also have exercise therapists or exercise scientists providing exercise-based therapy as part of routine care. And I think the critical thing that I'll stress, Mahmuda, is that the evidence doesn't say that this replaces existing care. We're not saying that, all you need is some push-ups or some exercise and that replaces your need for psychological help. It doesn't. What we're saying is that they should be together. It shouldn't be one or the other. We should be addressing physical health and mental health at the same time. And I think we have some good examples of how that can happen.
Okay. Yes, that's actually true what you have mentioned. It's actually not the thing, but definitely it is another part of our well-being. Here, if we continue this physical movement and activities or sports, it will help us to ensure or enhance our well-being. It's also the parallelly working to promoting our mental health. So mental health and physical health, they are always going together. As WHO already mentioned, no health health without mental health. That means like we have to be very careful on our mental health. When we are mentally sound, definitely it will impact in our physical health. So thank you very much, Simon, for your introduction. At the same time, like, okay, if you can relate these things, like you did this research, so today we can discuss more about this background and also how you did these things. Because at the same time, when you were working at the same time in the same journal, I have published another publication, that one also very much relevant. We also focused physical activity and sports, especially we focused on the adolescent mental health. Might be we can have a discussion that part as well, but we are very much interested to know more from you, because we had less opportunity, we will not get you several times. So we would like to grab this opportunity, and also we would like to discuss more on it, because people cannot understand this thing. Sometimes people are confined. When people are in stress, they are just feeling stiff, they don't want to move, they don't know like this movement can give them little bit of relaxation, it heals. So might be it could be another thing you can discuss with us, and also from your experience, not only the research but also like your university, how did you work, and also if you have any evidence in other countries or other operations, you can mention everything, whatever you like. We are really ready to listen to you.
Sure. There's so much to cover, and I think I'll just say your contribution in the Intervention Journal as well was really exciting for me to see, and the focus on adolescent on adolescence. I think where do I start? I'll give a little bit of a background about my journey and how I ended up really interested in this idea of physical activity, mental health, and particularly in refugee contexts. And I think it started here in Australia, working in a hospital, working with mainly veterans and emergency service workers who had severe post-traumatic stress disorder. And what I found in the hospital, talking and working with these predominantly men, but also some women, was that physical activity was part of their recovery and part of their management. It had an impact on how they felt, it had an impact on how they slept, it had an impact on their overall state of mental well-being. And we ran in 2015, we published results from a randomized control trial looking at the impact of adding exercise to usual care for people with severe post-traumatic stress disorder. And what we found was that it contributed to reducing symptoms over and above usual care. So that was really promising. Now, the other thing to note is we know around the world that conditions like post-traumatic stress disorder are associated with poor physical health. So things like diabetes, like heart disease. And actually, when we look at what people living with mental illness are dying from, predominantly it's not suicide, it's preventable premature heart disease that we can prevent. So when we think about activity, there's almost two things that it can do simultaneously. It can improve our mental health and also improve our physical health at the same time. So doing that in those contexts, I learned a lot about how the potential, or the potential impact and the power that exercise can have. And then through colleagues that I've been lucky to work with here in Australia, Dr. Ruth Wells, for example, at my university, we did a little bit of work in Turkey, in Gaziantep, looking at what about the role of exercise and that was an urban refugee environment. And we were really interested there in things like self-care. So if we think about mental health professionals, if we can train them to use exercise for themselves to manage their own health and well-being, then they have more skills to use with the clients and the beneficiaries that they're working with. And we've seen that all over the world, that's actually a really important part, because when we talk about exercise and activity, it's actually a big cultural shift in the way we think about mental health. And, we often have these silos where we have our mental health, we have our psychiatrist, our psychologist, and we think about mental health, and then we think about physical health, and they're separate. And that's all around the world. But increasingly, we're looking at bringing that together, and that also involves looking at the training of mental health professionals. So I think given the evidence we have, given how strong the evidence is, we should be saying, well, actually, mental health professionals should know how exercise can work and how they can apply exercise and support people. So I think, some other things from our research that we found was, in Cox's Bazar, was also looking at, it pointed out the universal nature or the transcultural nature of sport and physical activity. We can see that no matter where we look in the world, no matter the level of deprivation or the resources, communities, people turn to sport and they use sport as part of connection, as part of healing, as part of recovery. It's a part of social fabric, and there's so much potential there. I think one of the key things for me is that I think we underutilize sport in these environments, because I think the way funders and donors often think about it is that it's just for able-bodied young men to compete. But actually there is so much more to it than that. It's so much more broad, and the people that really stand to benefit the most are those that don't have the access. So I would say in certain cultures, in certain contexts, it would be, women often are less likely to have access to culturally appropriate sporting environments. People living with disability, these are groups that we should be targeting and thinking, okay, how can we make sport inclusive? How can we reach as many people as possible, not just the ones that are the fittest and healthiest?
Okay, thank you, Simon. I am interested to know more about. You have just mentioned in Turkey, urban refugees. You have piloted this one. So, how did you find, like, especially Turkish and also in Cox's Bazar Rohingya refugees? As we know, both are Muslim and also they are conservative on this part. So, which types of physical activity did you suggested and try to find out? And also, as you mentioned, mental health professionals should know these things. So which type of physical activities you are actually, if you want to recommend for this community, especially people who are in adverse situation, you can suggest us.
Yeah, I really like this topic and this question. It comes up a lot, this idea about, well, what is the best type of activity? And there's a very simple answer. It's the type of activity that someone enjoys. So the enjoyment is really, really critical. Now, it's not my job to go to different communities and tell people you have to do this specific exercise, because that won't work. Communities don't need that. They don't need me to come and say, you should do this exercise. What they need is the support and the resources and the infrastructure to do the type of exercise that is culturally appropriate and that they enjoy and that they want to do. So I think that's the first thing. The evidence is very clear. If you ask me what I'm most interested in, where there's a lot of potential, I think it's in what we call resistance training, which is maybe a bit foreign to some people. But what we're talking about there is essentially what we call muscle building exercise. So it could be, if we think about, traditionally people will think about images of very strong people in a gym lifting weights. It doesn't have to be like that. There's lots of things that we can do with our body weight, with really minimal equipment, where we're essentially moving our muscles against a resistance. And we can use elastic bands, we can use things we have around the house. That sort of activity is actually can be done by anyone. It doesn't need a lot of room or a lot of space. It doesn't need a lot of equipment. And we know that from the evidence we have that it can have a really significant effect on things like anxiety and depression as well, but also improving our physical health. So there's that double benefit. So I think the type of exercise is not important. And the WHO guidelines around physical activity also don't specify a type. It's really about what someone wants to, what they enjoy, and what they want to do is the critical part. I think the other key point is that we help people understand what exercise means and what it is and what it isn't, because it's going to mean different things to different people in different cultures, in different contexts all around the world. And I think there is that common link. It's around moving our body. And I think the interesting thing for mental health professionals is if we think about sitting opposite a client, talking to a client, or therapy, or what we're doing, for some people that can be intimidating. It can be a bit difficult to engage with, or there might be stigma around accessing mental health services. Sport and activity doesn't carry quite the same stigma. So an example here in Australia I can give you in our early psychosis program. So treating young people with psychosis, we actually have a dedicated exercise facility and a kitchen to help people learn how to cook as part of the treatment program. And it makes the entire mental health service more accessible for young people or for populations who don't necessarily understand mental health or mental health care. So I think there's a way that we can use these sorts of low stigma, acceptable, universal strategies around it, our physical health and activity and sport, to actually engage people in mental health care. And I think young people is another classic example. We know that young people congregate around sport, around organised sport. It's a way that we can engage, deliver public health interventions, deliver education as well.
Yes, thank you very much. This is very good example. Actually, physical activity we learn from you. It is like people enjoys a lot. Which one? That means there is no particular definition on it or the time frame and anything not like super frame, but at least people can enjoy, and also the involvement to reduce mental health problem or issues. You have mentioned a very good thing, like, okay, people are involved with cooking. This is a very good example. I can tell you, like, I can share my experience. In 2017, when refugees were coming during the influx, that time you might know, like, many shipwrecked happened that time. Many people are dying. They are losing their loved ones. So that time it was a great experience. At the same time, very difficult period for me, because we had a very limited resources, and also we didn't know what to do, because people were not ready, organizations were not ready to do psychological support, how to provide mental health and psychosocial support. So everything were mess. That time I went to meet them, and I found, like, in one ship they lost almost 16 people, and rest of the people, they were living, like, we kept them in a school that we were not ready, because we didn't have camp that time as well. So what happened, everyone, we didn't find any private place for them to discuss. So I was talking with them, and when one person was sharing their event, another people were starting to cry. That it was a common healing process. What I found, like, yes, it was also working that time. It's good, like, okay, I'm not getting any private place, but people all are there, they're sharing each other. And that time what I tried to do it, I didn't know, because even I was not ready. What should I do? Because this is the first time in my experience. So I immediately planned with them, like, within this group, people who are still, like, a bit alive, they have more strength, coping, their mechanisms are strong. I tried to grab them, and I involved the same activities. What have you already, what you mentioned, that is, like, I ask them, do you like to serve food for them? Would you like to be involved with our community team, to help them to cook food and serve food? And they liked it, because they think, like, instead of sitting, instead of crying, this is a good process if we can be involved. And also few mothers, they had very little child, so I also asked others, like, do you like to spend some time with them? And then they find themselves a good community relationship, ownership, and also some movement. And that time they find this is really very good, and also it helps and it works. So this is my experience. I find, okay, this is the good thing. What can we do? Physical movement can give us some strength to heal our mental health issues, or especially it works for grief and loss as well. As you mentioned, post-traumatic stress disorder, that means they were in acute stress, but at the same time it is the process of healing. They could work together. Thank you very much, Simon, for this example. And I think, like, yes, we can learn from this evidence, especially for the mental health and psychosocial support aspect. what we are trying to do through this program. Like we want to spread this message, these ideas for all the mental health like professionals and donors and funders, so that they can also understand how versatile mental health activities are, how can we integrate and incorporate. And today we are also finding some new ideas with mental health and physical activities. And also, okay, now I would like to know more about how do you see the relationship between sports and physical activities can help for mental health?
Yeah. I I just want to pick up on some of the points you just made there. I'm just scribbling notes because there's so much there. I think one of the key things, Mahmoud, I just want to touch on is this idea of prevention. Because I think that's such an exciting aspect of this work. And I mean, the story you shared about your experience in 2017, I can't even begin to imagine what that would have been like. I think what it's making me think is this idea of prevention. And particularly now with COVID, I think is another example. If we think about our health workforce, with full hospitals, we've seen images of that, and the health workforce is completely stretched, the same as humanitarian workforce. I think we really need to be aware of this evidence around if we keep people physically healthy, it can actually protect mental health down the track. And I can give you one statistic from some research that we published in the American Journal of Psychiatry in 2018, led by my colleague and friend, Dr. Felipe Schuch. We did a big meta-analysis of prospective longitudinal studies showing that if we get people to engage in as little as 60 minutes of physical activity per week, we could actually prevent up to between 12 and around 17% of cases of depression, incident cases of depression globally. And that's just by shifting people to do a little bit more activity. Now, similarly, we know that physical health declines associated with mental health. So, for example, as soon as someone's mental health is challenged, we see changes in their physical health at the same time. So I think this idea of prevention, ensuring we keep the workforce fit and healthy, can have a big impact on mental health as well. One of the other things that you mentioned there in your example was this idea of control. Now, often people living in crisis or people living in displacement or whatever the context is, there's a lack of control, which can feed into how we feel. Now, sport and activity is something that can bring a little bit of control back to that individual. No matter the person, no matter the context, there are certain things that can be done around physical activity and movement that can help with those positive mental health benefits. And I think that's one of the pathways around how this can help. And then coming to your question about sport and physical activity, they are slightly different terms. So I'll just clarify what they mean. Physical activity is essentially any bodily movement. Anytime we move our body, so if we are standing, if we're just walking, that's physical activity. Sport is an organized, structured subset of physical activity, typically arranged, and typically, often we have team sports as well. And then exercise is another term that just refers to planned activity or planned movement. And there was just, I know I'm wandering all over here, Mahmoud, I'm sorry, but there's one other comment I just wanted to make, and that's just around the link between exercise and weight loss, because typically that's what we hear a lot about. When people think about exercise, they think about weight, and the reason they want to exercise is they want to lose weight. It's really important that mental health professionals in particular understand the relationship and understand that the mental health benefits of exercise are independent of changes in weight. So in other words, someone can benefit from moving their body without losing weight, and that is absolutely okay. That's what we should be focusing on. We should be focusing on how people feel, not how people look, in terms of the benefits, and promoting for people they should be exercising and thinking about even their food. We know there's a relationship between food and our mood, but it's about how we feel, not how we look.
Yes, I was just telling exercise and also physical movement, but how do you see that about the sports, like when people are enjoying, because sports also related what we see about the mental health, it could be indoor or outdoor, both are like having some movement. So what is your opinion, like is it included with like physical activity, sports can be included, and also how it impacts your opinion?
Absolutely. So again, it's that idea that any type of movement, any type of activity can be beneficial for our mental health. Sport is a bit of a special example because it has some other added benefits as well. It brings social connections between people. There's potential for sport to play a role in peace building between communities when they're able to play together and play against each other as well. So there's some good research around that area and peace building, and also social cohesion. Sport also can provide a bit of meaning, a bit of purpose, but it can also mobilize communities together. If you think about organizing a sporting tournament or a sporting environment, it can galvanize the entire community around that. And I think we've all seen examples of that, including in Bangladesh. Yeah, I think one of the important points is that when we think about sport, we don't only think about the elite. We don't only think about the Olympians who are the very, very best. We need to think about the majority and think about those, the principles of the Olympics in terms of participation and actually ensuring that anyone who wants to participate can, and it's not just about competition.
Yes, exactly. Like I can share from here in Afghanistan. Afghanistan also the community is very strong, and also there are some limitation for the Taliban's. They are not allowing, especially for the female movement and outing, sports, anything. So we try to do something with them because there is one organization who are promoting physical activities and also the sports. Just they are trying together which one is possible. So they gave very simple definition, especially for the sports. They're saying like sports is not, as you mentioned, this is not the Olympians. This should not be like this, but at least might be we can do something for the physical movement. Like they came up with some ideas what we liked most, but unfortunately we could not implement because of some limitations. This idea was like this: okay, females, especially the school girls, they can come and we can invite them. Okay, girls, today we will have a session in peak of the mountain. That means we will walk. We are not telling them this is sports, this is physical activity, so that people cannot be stigmatized, because still there are some limitations. So they are not willing, parents are not willing to release them. Okay, no, we cannot do this. If we do this sports or if we go outside, it will be like a demonstration. So also this Afghan community cannot accept these things. So they have different ideas, but we liked it very much, but we couldn't do this. But I like these things. Yes, like some different ways how we can involve them, so that okay, we will do some. Okay, we can tell mental health session, awareness program, or something like this. But what can we do? We want to make them move, because females are not moving. They are confined. They are in their household. Might be some school girls, they are going to school and coming back, only these activities they are doing. So how can we involve them? This could be the way. Like, this is not running. This might be the slow walk. But as you mentioned, peace building, social cohesion, connection between the people, so they can know each other. They can have chat during walking, but it is also giving them some refreshment. We had different ideas, but it couldn't work, unfortunately. But I wish and I hope might be in other operations or where it is possible. Definitely we will try to do these things. And also you have mentioned about the sports, any kind of things, it's also helping these things. So it is also involved with our physical activities. Like what we try to do these things, especially for the adolescent girls and Rohingya refugees. Adolescents are also the same. They didn't have the opportunity to go to the school. Even they couldn't move because they are only inside their house. So we offered them, do you like this? And everyone was responding, yes, we like to do this. Some outdoor activities as well. So how could we make it? So we tried in a different ways. we thought, okay, let's make it only within the female, so that community leaders can accept these things, imams and also community influentials. We went door to door. We discussed with the religious leaders, like, how do you see? At the beginning they were saying, no, it is impossible, we cannot do it because this is against our religion. Female are not allowed to play or go outside. And then we discussed, even if what happened if we can make a space, private place, bigger space, and we can make a fence for them, and they can only female audience can come, and the time they can enjoy, they can do the volleyball, soccer, anything. So that time religious leaders were uh, interested. Yes, might be you can make it. And then, like, we did it, like on the event of the World Refugee Day from UNHCR, we arranged this, and also we got huge response. Female were enjoying and they were laughing, they were just telling, this is amazing, I couldn't think like I could do this. But I thought, when male are doing this football games and they are playing in different areas, we were just looking for through our windows, through our broken fences. But now we are the part of it. So they showed their joyous, and also they feel like, okay, if we can make it, we also physically feel good. They express their impression and also what is happening inside. That time we found this is really important, because sometimes, like, we didn't have the idea, we couldn't know how to do it. But when an idea comes today, we could learn a lot from you, like, yes, physical activity can help a lot to reduce PTSD. And also, even you have mentioned, even a psychotic patient, we can involve them for cooking or few other activities, so that they can feel like I am busy, and also it is helping on healing their mental health issues. Sometimes, like when we are in overburden or overwhelmed with sorrow or sadness, especially for the depression people, what they do most of the times, they actually wouldn't like to move. They would like to lay down, or they are always in a same position, because they are just overthinking on it. I am worthless, I cannot do, I am weak. And also family members or friends also, they are always blaming them about this. So they are having something negative thinking in their mind. So if we can slowly make them a bit involved in their regular task and physical activity, especially you have mentioned focus, which one people are enjoying, this is the most important thing. Like, we have to find out these things. When we will deal with our mental health people, I think this is very important. We should ask them, what did you do before, what you enjoyed a lot to do these things, then we can yes.
I
So
really,
yes,
sorry, I really like what you're saying there, and some amazing stories. What comes to my mind is something that we've had to do here in Australia, but also in other contexts around the world, is when we're trying to implement this, we need to think about the staff first. And we've got some good evidence around this now, that if we're trying to think about how can we find different ways to implement physical activity for people experiencing poor mental health or mental illness, start with the staff. And I mean with staff-focused exercise programs, because it serves two purposes. One, it looks after the staff's own health. So self-care is so important. But two, it also gives them extra skills, because they can see for themselves what the potential benefits, so they can experience it and feel it for themselves. And what we've seen in different pockets around the world is, by focusing on staff, upskilling staff, giving staff access to a structured program, it has knock-on effects onto beneficiaries and patients. So I think that would be for me, I think we need training. We need to have training courses available for MHPSS professionals in physical activity, because the evidence is so clear that this could be such a powerful part of their work. Again, it doesn't replace what they're doing at the moment, but it should be an extra tool in their tool belt, so to speak, that they can actually use, better use the potential of physical activity with different clients. And then the other thing that you touched on there was around, depression and some of those symptoms around a lack of motivation, inability to get up and staying in the same place. We know that what we call sedentary behavior, so sitting, the amount of time we spend sitting or lying, is related to our mental health. And we know that when we take away the opportunity to move, to exercise, to walk, it's associated with declines in mental health. And so it's not only about trying to get people to do more activity, it's also about trying to think about how can we do less sitting and less time simply sitting in a chair. So we need creative ways around this.
Yes. So you were suggesting this thing, like at least to need someone, MSPSS professionals, instructor. Also, they should be trained. They should know this thing so that they can also help themselves as well as for the community and also the target population whom they are working for. So this is another important thing, like through this program I would like to disseminate these messages. This is also important, like if we would like to integrate mental health with physical activity, definitely we should incorporate this part. We might need to develop some different curriculum to train our MSPSS professionals so that they should know how to do it. And also, as you already mentioned, though physical activities has no boundaries like time frame or which type of movement, but at least for the program, mental health program, we might set some sort of curriculum so that it can cover the time and also resources. So everything we should take it in our consideration. And I think it might be a good idea, people who are watching us, and also especially for the mental health professionals, they can think, who is especially the implementer, they can think about their mental health stuffs, like how they can incorporate this thing and integrate with physical health, with physical movement, and also mental health. I think definitely it would be another way of raising or promoting mental health for our people, not only for the people who are in adverse situation, for all the people, especially people who are having mental health issues. We can also assign them for some small physical movement task, and also might be some sort of very small indoor games, or somehow some even in exercise, though you have already mentioned, might be there is a relationship with exercise and also the weight gain and loss, but might be something which can give them very short and simple task, and which will be not burden for them, but at the same time it could be benefited for all. So thank you, Simon, especially for raising these issues. I think today we are discussing very important part, which is not like regular thing in our mental health professionals, but it can be like we can think more on it after this session. Especially I will tell, like where I am working, I will try my best. Might be you can also expand, already you are working. For this reason we are trying to learn from you how we can actually integrate these things. We can have a greater discussion on it. Thank you, Simon. Now I would like to ask you, like, and do you have any future plan to do more with this, or what is your planning for mental health and physical activities?
Yeah, thank you. Look, this will get me very excited talking about this, and I think, and it also links to what you were just saying, but I think one of the most exciting potential things here is that we have these different worlds. We have the mental health world, and we have physical health world, and in that, depending on the country, I would put things like physical therapists or sports coaches or people who organize exercise. And there's two things that we need. We need to upskill the mental health sector. So the MHPSS staff, psychologists, social workers, counselors, they need some training in exercise and physical activity. But also the physical health people, so physical therapists, sports coaches, exercise, professionals, they need training in mental health. And so we actually need these professionals to come together, because there is so much potential if we're better able to integrate mental health, so improve the mental health literacy of the physical health workforce and improve the physical health and exercise literacy of the mental health workforce. So I think that's what I'm most passionate about or excited about in the future, Mahmouda. And also, I think just the potential of this message and the evidence we have, building on that evidence base with examples from around the world. So, the stories that you've shared from your experience about trying to, running into barriers, but trying. We need to document that, and we need to be able to disseminate that around the world, so that we can all learn from other examples and what works, what doesn't work, and then together use that to come up with even better and new programs. So I think that's probably the future, what I'm really excited about. So really learning from other people too.
Yes. Thank you. Thank you very much. This is another initiative. Yes, actually, physical health workforce and also mental health workforce, if we can run together, it will be more effective, and also people will learn. And especially like for mental health, we are working in both sector, health and protection sectors. So we can work in a broader way, how we can run it, like either in protection, either in health sector, because like for mental health, we are nowadays promoting many more things which are more linked with physical activities, even in mindfulness, even you say like grounding, and even yoga or meditation, breathing, relaxation exercise, everything. Most of the activities are relevant with our physical activities. So we are trying to day by day, and people are also learning these things. I think this is another new part of our mental health provision, so we can focus on it. Mostly like we do these things, we understand these things, but might be something is missing for our mental health and psychosocial ground. So people are not understanding these things. They might be they have in their mind, but this is not a thing. People are not finding this issue. Okay, this is very important, we should focus on this. But I found like, okay, might be this is another wing. After today's discussion, I don't know how many people are listening to us. Might be after that, if we get this opportunity, we will try to discuss more on this part, on these issues. We have to disseminate these ideas so that people can learn and people can also find these things. Yes, physical health, mental health, and also this movement, why necessary and how we can structure it, especially to develop a curriculum, because AEST guideline, they have many more things. Might be we can raise these issues, how they can be more structured in our any kind of meetings or webinars. We might raise this issue. I find this is very important, because it is something giving us very practical suggestion and also solution to get a good solution. So thank you very much. I think Simon, you have given us a new idea and also new understanding. It will be helpful for us to incorporate health and also I will say physical activities, sports, exercise, something, a package which we can make it. And this is a good idea to develop like professionals who knows very well and who can help us globally to provide, or might be some global platform who can train a bunch of people in globally, and then they can run on around the world in different NGOs and other private sectors or even agencies for the people, so that they can train people. And also it can be like, okay, from their ground, staffs are getting training, staffs are providing training for the community people, and community people are helping for their community. In this way, might be we can develop something. So yes, Simon, now
I love
yes,
what you're saying. I mean, imagine if we had a focal point. Imagine we have a mental health focal point. Imagine if we had a sport and physical activity focal point, and it was their job. One of the key things that you've touched on there is the role of peers. or the role of people with lived experience. And we're seeing that in our research here in Australia, but also overseas. They can often have the most influence over people. They can, be inspiring because they've had the experience, they've lived through it, and they can help motivate and bring people along on that journey. So I think there's so much potential around how this could look in the future, and I think that idea that you're talking about there would be amazing, and also a way of sharing. So building that community of practice of people around the world interested in this, to be able to learn from each other.
Yes, actually, when we started with mental health, still mental health is stigmatized. So we are working for it. So this is another part. Might be, yes, as I mentioned, there are some contexts are not positively taking this part, or there are some community people they have a strictly like opposition part, like, okay, female are not allowed, adolescent girls are not allowed. So somehow, but still for mental health we are struggling. So might be we can run at the same time a new program, and we can think it in a different way, in a positive way, as we mentioned. Might be slowly we can, and it is really very good discussion I find today. And also you are working on it. I don't know either we could get the opportunity or not, but we will try to do something. And also might be in different seminars, symposium, or conference, webinars, we would like to extend our ideas. And I think someone, yes, you already you have a publication, you can work more, I hope, and it will give us a good solution, because it is amazing. People can find the result immediately with this physical movement. This is my understanding, because people also want to get something beyond medication. Yes, medication is one part of the mental health service or the treatment process, but at the same time, if they get something materialistic, definitely physical activities will be one of them. But somehow we are not taking it seriously. It is like we a bit aside. So from today's discussion, we have at least the new ideas. We especially, I learned a lot. I think our audiences also, they have the very positive view on it. So you would like to add something more, and if you want to ask something to us, you can. Yes.
I think for me, I just want to say thank you for highlighting this topic. It's really exciting for me. It's more exciting when I can hear stories from other people around this. So I think, I would love to learn more about your experiences and the challenges that you've faced, and how, even potentially how I can maybe support from my background and my knowledge. So anyone working in this area or anyone interested, please just reach out, and I would love to be in touch and work out how we can progress this as mental health professionals, I guess, how we can make a difference. So, thank you, Mahmouda, for everything that you've done and for highlighting this topic.
Yes, thank you, Simon. It's also great honor for us to have you, because it is difficult to match in different time zones. You are from Australia, I am from Afghanistan, and this channel is from North America, and also a group of Bangladeshi people are controlling this program. So all the things, it is not too easy to maintain, but we are happy because this channel is especially working on promoting mental health. So this is Global Mental Health Journey program, weekly basis. So we are inviting all the people who are the specialists on special and specific ground on mental health, and it is helping us a lot, because we are learning, we are growing, and also emerging mental health professionals are learning a lot. So I think, Simon, at the end you can add something like how did you were involved with this, and also about your university, because this is another motivation for our young generation. Like, before ending, at least you can give us some motivational words, so that people can also be motivated to study in different universities, and also in different topics, especially focusing on mental health.
Sure.
Yes,
So I guess I will say that, I'm very fortunate and lucky to have um, had the opportunity to do research, it was never my plan. So it was never something that I was interested in. What I would say is that if you're interested in research, find a topic you're passionate about, because that will make it much easier. Research comes with a lot more negatives than positives in terms of, we submit papers and, most of them will get rejected a few times before they get accepted. So there's a lot more rejection than there is acceptance in academia. And I think the way that we get past that is by having something we believe in and having that vision or that purpose. So I would say for anyone interested in research, I would absolutely encourage it, but say, find that topic that lights a spark inside you and makes you feel excited to want to pursue and understand more about that. And I think the other thing for me is actually, really asking communities, asking people that you're working with what they need. And not assuming that we have the answers, but really asking what it is that people need. It's often the hardest thing to do, but it's also the most important and the simplest in many ways. My university, I'm really fortunate that I'm not a psychiatrist, I'm not a psychologist, I'm an exercise scientist, but I work in a psychiatry department, and that has been a really big part of my career, because they have supported and welcomed me into the School of Psychiatry, which allowed for a different audience. Because it's one thing for me as an exercise scientist to say, hey, we should look at exercise. But, again, why I'm so grateful to you for having me today and for 4MTV is that it's a different audience. It's so much more powerful coming from you, that message, because you are a psychologist, you work in that area. So that's what we need, is we need champions from within. So anything I can do to support that, that's what I'm happy doing. But it's really about how can those champions take that message and run with it. So yeah, thank you again for your time, Akura.
Yes, thank you, Simon. This is great to know, like you are ready to support us, and definitely this will help us a lot, as you have already mentioned. Like, if people want to do any kind of research, people should learn, and people should have interest on it. Otherwise it would be really difficult for them. So this is another very good message for the, I think, new young students and also fellows who wants to do some different researches, especially on this mental health ground. So they have to think on it. And also this is another great opportunity. I don't know how we can communicate. Might be University of New South Wales also a very good ground. I think someone, you are also aware, like a few days ago we had another publication on one evidence-based psychological intervention, and from this University of New South Wales, and Alvin, this guy, the clinical psychologist, yes, Alvin Chair, and also I was the principal investigator from Bangladesh. It was another great opportunity for me that I could get this opportunity, and I learned a lot how to do it from directly in the field. I was there, so it was the ground on the field. If we get the chance to know from the field, so I am requesting all the people. Okay, thank you very much for watching to us, and also I am going to thank especially Simon. It's a great opportunity for us, and also every week we are trying to bring someone. Hope people will be with us, and also we are like still this the opportunity. We are continuing our learning and exploring, sharing, and exchanging our knowledge. So thank you, Simon. Thank you very much. And from 4M channel, this is another chance. Hope in future we will get you again. Thank you very much.
Thank you, Mahura. It's been a real privilege for me to come. So thank you very much.
Okay. So, dear viewers, now, yes, we are going to end our program. Before ending, I am trying to give you the reminder, like this channel, already we have mentioned, you will find us in our Facebook, YouTube, and also with some other medias, feel free to contact with us. You will find our contact number in the scrolling, and also we have our email ID, so you can always write down to us, and also you can email to us, info@the rate of 4mtvusa.org. In this email, your ideas, and also you are always welcome. If you want to be a part of this program, also you are invited. Thank you very much for watching us, and thank you all.